Okay. Another, dear Dr. Mike, sorry this will be long. New to TikTok, thank you for taking the time to help all of us struggling. God bless. I'm 38. My conditions are epilepsy, says they're on Lamictal, seizure-free since 2005, high blood pressure on pills, fibromyalgia on Cymbalta, and scoliosis hardware installed in thoracic 2000, removed in 2013 due to being allergic to the nickel that made me sick for years. MRI results is lumbar dextroscoliosis. Number 2, severe spondylosis at L4, L5, without compressive spinal canal narrowing. Lower facet, number 3, lower facet arthropathy contributes to mild bilateral neuromal. You give me all your MRI results. Okay, I see. I see now where I should have paused. Okay. Anyway, lower lumbar facet arthropathy contributes to moderate bilateral neuromal foraminal narrowing at L4, L5, and on the right at L5S1. Been in pain management since 2012. First pain doctor for 10 years and had a great relationship with that one, but he moved. They recommended I take the first available appointment with the new pain doc and go from there. And I already knew that the next word was going to be big mistake. And guess what? It says right there, big mistake. Never had an issue with urine tests, pill counts, or anything from the old doctor. Started new pain management doctor April 2023. Things seem fine, no issues. Same as old doctor. Kept seeing more negative Google reviews and hearing upset patients in the waiting room. At 2 different appointments with the doc, my mom was with me, and 1 appointment with the nurse practitioner alone, we had to discuss how to best use my 4 7.5 bikes wisely and for pain flares. Never had any real pain flares. Doctor said if it happens to take half or 1 extra a day on flare days, knowing I'd take less pain on less active days. Jan, my mom, had to abruptly come home for a court hearing because she is executor of my late aunt's estate, and she was finally getting control of the house. The aunt before had destroyed it, living with no water, and he's okay. The aunt's boyfriend had destroyed it. He was living with no water, and he's an alcoholic. It was awful. Had less than 2 weeks to help my 65-year-old mom. I slipped on some icy steps. Caught myself, but caused a severe flare. No choice but to keep going. Use the pain meds the doctor or the nurse practitioner had told me. Call in for a pill count on January 26th. Get a phone call from the nurse practitioner saying the count was short. 8 pills, but I had 2 broke in half, and they didn't count. And the doctor was putting me on buprenorphine patch. I reminded them of the pain flare protocol, allergies, meds. It didn't matter. Nor would they listen, and I guess it wasn't in my chart. They would not let me make another appointment or communicate with the doctor at all. I wasn't going to allow them to even prescribe it without discussion. They said it's this or nothing. How many times have we heard that? I dismissed myself. See the new pain doc on the 18th. Worried about how this might go, what to expect, and what should I say because of course it's going to be on my record. Advice. Also, besides buprenorphine, Suboxone, and methadone, what other medications the new doc might try to push on me that I should be trying to avoid? Any recommendations on anything I should do or should not do? Any ER meds or IR meds that I might ask him about if he doesn't want to put me back on my 4 7.5 Vicodins per day? Pain has been untreated since January 31st. I have 1 pill left. Should I bring that 1 pill? Also, should I wear makeup? I look awful even with pain meds. Eyes are so dark, but I rarely wear makeup anyways. Sorry for all the questions. I'm so stressed. I'm in pain, and I have bronchitis right now. I also have weird... Okay, so this video is going to be a little bit disjointed because I accidentally said your name, and I didn't want to do that. So you ended with, you have bronchitis right now, have weird allergies to metals, plastics, silicones, and adhesives. You were set up. Here's my advice to you. You want to know my advice to you? My advice to you is understand you were set up. They gave you bad advice. They gave you the exact opposite advice that I give my patients, okay? I tell my patients that we have to come up with a plan that covers flare days from the beginning. From the beginning, covers flare days, because taking extra medication causes you to make a promise to yourself that there's no way you can be sure if you can keep it or not. So when you go to the new person, don't be worried. Just tell them what happened. Tell them exactly. Tell them literally, like I read it off. And don't be worried that you don't have substance use disorder, so don't let them put you on buprenorphine, Suboxone, or methadone. Keep looking. I know it's going to be hard if they say no, but I would rather you start this relationship from a place of mutual respect than for them to call you a substance use disorder patient when you're not. Let me say that again. I would rather you be told no than to start a relationship with their incorrect assumption that you're a substance use disorder patient. That's not it. This is a great example of someone that's not a great Suboxone patient. So don't do it. You don't have to. Be prepared. I love one of your questions. So try to take that one pill. I don't think it matters. Don't. They haven't written since January 31st. There is no reason for anybody to believe you still have any medicine left. Should you wear makeup? If you feel like it that day, put makeup on. If you feel like shit that day, show up feeling like shit. Okay? Let's see here. I want to make sure I got them all. Any ER or IR meds that I might want to ask him about that if he doesn't want to put me back on your 7.5, start with if that plan worked. Ask him, you know what? This is what I would do in your shoes. One more thing. I would ask him if you could have an extra 10 or 15 tablets a month. Ask him to write it for 5 times a day, but for a 30-day supply to be 130 rather than 150. Then you've got your 10 flare pills already built in. Do you see what I'm saying? Most of all, understand, one more time, I'm going to say it, you were set up. Don't stress about that. You've got nothing you need to be defensive about. Tell them your story as dispassionately as I was able to read it off the page. I know it's passionate when it's you. Practice telling your story dispassionately. And you really got it down. You don't have it down to 3 minutes, however. You're going to have to edit it. Okay? Remember I told you need to get your story down to 3 minutes? Yours is about 8, and I read fast. I added my commentary, but still, it's not 3 minutes. I love you, no buts.